Good afternoon and a very warm welcome to all of you. Welcome to a new session of HT Spotlight titled VaxTalk. Now, getting your child summer ready is what we are going to talk about in partnership with Sanofi, a world leader in vaccines. Today's discussion delves into a topic that is top of the mind for most of the parents now that the schools have opened up and the children are back in school offline. So, the quick question is, how do I keep my child safe from infections this summer? So, after 2 long years, now the schools have opened up. Children are finally back in classes, they are back in their routine. But with this, the instances of infections have also gone up, and we see around us many kinds of common infections again flaring up. It could be common fever, it could be flu, it could be stomach infection. We are seeing an increase in cases of children with fever, stomach infections as they're going to school. There is also the allergy season that is doing the round. Perhaps it is because the children are, stepping out or eating out after a long break. So naturally, as parents, all of us are very concerned, and we are trying very hard to keep our children safe, and we are trying to make them summer ready. So the reason and one thing that we are focusing on is how do we boost the immunity of these children and keep children healthy and infection free, because as the intensity of COVID-19 infection begins to fall and masks have come off, the bad news is that the cases of influenza are on the rise. In fact, it has gone back to the pre-pandemic time. The last 2 years, when due to COVID-19, there have been closures and lockdowns. The cases of influenza, as well as other infections, were low. But now that things have opened up, we are again seeing a rise in flu cases. So the last 2 years, influenza activity has remained low as compared to the pre-COVID times. Low levels of immunity within the population, driven by factors around like COVID-19, could cause a major surge in flu this summer. Experts predict that we may see a rise in flu cases. This increased in is attributed to many factors. Firstly, the measures people took to safeguard themselves against COVID, like wearing masks and limiting social gatherings to small groups, and trying to make outdoors where the spread of respiratory viruses is harder, helped in limiting the flu activity too. As people, including children, start stepping out again and ease off the precautions being taken for COVID, they are attracting infections infections too. For small children, doctors feel that 2 years of being at home has impacted their immunity too. Remember, children haven't stepped out, they've not done their natural physical activity. It definitely affects the immunity in children who are growing up, who are developing their immunity. The influenza virus has an annual attack rate of more than 40% on preschool age children and more than 30% on school age children during outbreaks, and leads to increased visits to the doctor, more hospitalization, and up to 20 to 30% increase in antibiotic consumption. Now, that's something we need to really think about. But how can we safeguard our children against influenza? Are vaccines effective? And are they safe? And what is the right time to take the flu shot? To address these questions and many more, we have with us for today's discussion a parent and a pediatrician to offer a 360-degree view of how to plan for your child's health this summer. I am your host, Nagma Seher, and joining me in this conversation is actor, model, and mother of two, Neha Dhupia. Very warm welcome to you, Neha, and Dr. Pramod Jog, former president of the Indian Academy of Pediatrics and professor of pediatrics at the D.Y. Patil Medical College, Pune. Very warm welcome to you, Dr. Jog. Dr. Jog practices at Jog Children Clinic, Media Point, and Jupiter Hospital, Mumbai. So a very warm welcome to you both. And this is a very important conversation, very topical conversation that we're going to have today. All of us around us also are looking at cases of rising infections, and we're all worried about our children. So Neha, would like to start with you as a mother of two young children, you know, those who've just started going to school. I think one of your a child has just started going to school, what are you doing to keep them safe and free from infections?
Hi, Nagma. Hi, Dr. Jog. And thank you, everyone who's tuned in to this session. And hopefully, it's going to be as insightful for you as it is going to be for me. Because, like you said, Nagma, that, for me right now, I'm a mother of two, but I'm also a worried mother of two, because there's so much in the air. Like, of course, you've got to take, we have to address the elephant in the room, which, of course, is COVID. We have to talk about it, and there's been so much focus on that. Now that those numbers are, they're dipping, which also gives us a sense of relief. But there's also flu, and there's common cough and cold, which then turns out to be another issue. And I still remember, before COVID, we would always worry ki, my child hadn't started going to school then. She was really young. And we would always hear ki, अभी तो देखो जब स्कूल जाएंगे तो क्या होगा. अभी स्कूल जाएंगे तो फिर रोज किसी ना किसी से सर्दी या जुकाम होगा. So, like you said in the question, so what is it that I am doing as a mom? Of course, for better or for worse, kids are not alien to the concept of mass. But what else can you do? You've got to address it, or you have to prevent it before you actually find the cure. So, of course, there are flu shots that are given. There's a whole sort of kind of medical routine that we have as a backup. There are other moms who reach out to us saying that, this has happened to my child. What do I do? Or maybe like, my child has a cough and cold. So, he or she is not coming to school. But what is really sad is off late, everyone has it. And what are you going to do? And I feel that I'm always getting it because of my children as well. Like I sound heavy even now because it's always one is getting okay, the other one gets sick, the other one gets okay. And then, one's 3.5, one is 6 months old. And this is probably the story with all children and all parents right now. But what can you actually do to prevent it? Like you said, and I mentioned before, one can take flu shots and one can take expert advice. And I'm just happy to be on this panel because today I've just come forward as somebody who wants to know more. And that's why I want to address my next question to Dr. Jogol. So that, hi, doctor, I'm just happy that I get to speak to you right now. But I also I'm talking to you as a worried mom. I mean, I have so many questions. Like, can our children be given this shot? Like, are there any sort of complications when our children get the shot? What is the number? What is, can a common cough and cold be of a higher, more, God forbid, more intense degree that we should be careful of? Like, can you help me with answers of these questions?
Yeah. Certainly, Neha, thank you. See, first of all, remember that all these infections are viral infections. Okay. Now, you must understand that viruses in general are, benign. Benign meaning thereby not very troublesome. Okay. There are two organisms in the medical field. One are viruses, which produce runny nose and cough and watering of the eye and so on and so forth. In general, if a child gets about even 8 or 10 infections in a year, okay, maybe once in a month also, you need not be worried about it. This is very important. It shows that the child has a very good immunity. Okay, in fact, when the child becomes sick, quite a few mothers who are worried, as I can see you're also worried, but you don't worry because each infection will give some immunity to the child. Okay, that is number one. Number two, if it's a bacterial infection, very high fever, even when the fever goes down, the child doesn't eat well, doesn't sleep well, doesn't eat well, then you should always consult your pediatrician, ask him whether something needs to be done. That is one. Now there are hundreds of viruses which are in the atmosphere. Some of them will only produce runny nose. The child would be fine in 3 or 5 days. Okay. Some of these viruses like influenza, they are very naughty viruses. Now what I mean by naughty, they keep changing their structure. Okay. Every year this flu virus will change the structure. So during 2020 it will be different, 21 it will be different. These changes are minor, but then even if a child is immunized against influenza in 2020, that particular vaccine may not be of all that help next year. So this is number two. And number three,
Oh,
and influenza is a disease which is not only restricted to the nose, but it has other symptoms like headache, body ache, and the child feels very weak. So influenza is a bit different than the common cold. Okay, and that's why in case if a child gets influenza, then he remains little sick for say 3 days or 4 days or 5 days. Okay, but eventually even influenza will recover on its own. Okay, yeah.
Yes, yes. Dr. Jog, here I would like to add to this point. You're talking about influenza. There has been a prediction or a warning from WHO that this year the influenza cases will be on the rise. Also, the summer has set in a little early. The heat wave is already there. April, right from the beginning of April, all over North India, we are looking at a heat wave like condition. So, this prediction of WHO that there'll be a surge of influenza or flu infections this season, what do you think is really causing it?
Yeah, it's a major concern for many of the health experts. This is because for last 2 3 years, if you see, everybody is using a mask or using a sanitizer or keeping people away. That's the physical distancing. With all this, not only the COVID-19 virus, but other respiratory viruses also are kept at bay. They are not, coming near us because they are not able to enter through the mask. Okay, that's why influenza in general has been at a lower level. So the immunity against influenza over last 3 years has not built up in any one of us. And people out of fear of going to the clinics and getting children out of the house, they have not taken the flu shots also, quite a few of them.
Yes,
And
yes.
that's why children also do not have any immunity. Adults also do not have immunity. Grandparents do not have any immunity. And that's why more the reason that this year it's possible now that the activities have started again, people have started mingling with each other again, that this flu virus, which always makes its appearance around the monsoon and in monsoon, will attack children and parents and grandparents. So we have to be careful, and that's the cause why
I have
it is.
a yeah. I have a question. You spoke about the flu shot, Dr. Jog, and I want to ask you, and you also mentioned that children and parents and grandparents. So you think as a family, one should collectively take the flu shot, and if we do, is there some sort of caution or timeline that we need to follow as far as the flu shot is concerned? I also
Yeah.
know that we've been told, and as a mom, I know that if your child has a runny nose, you shouldn't take it. Are there any sort of other disclaimers when it comes to a family taking a flu shot or children taking flu shots?
Yeah. I must say you are a very responsible parent, and you are thinking of all these things before giving shots to children. Remember,
No, no,
minor
no, no. I
illnesses.
think there has to be one thing about for moms as well. The thinking is not thinking. You're being very nice to me. I'm always overthinking. I feel like 90% of my brain is consumed by my children, and I operate for the rest of the world on 10%. So yeah, I'm an
No, that's
overthinking
fine.
mom.
No, that's fine. See, every child at the age of 6 months, okay, 6 months from birth, receives the first shot of flu vaccine. After a month, that is when the baby completes 7 months, the second shot of flu vaccine is given. This is called primary or the first vaccination of the child. Okay, if a child has minor cold, that is not at all a contraindication. That's not a reason why you should
Oh,
not give flu vaccine. Okay, remember, it is very important because flu, as I told you, is a different disease, and it produces fever, headache, body ache, and so many other things. And we need to protect the child against flu. Number two, this disease affects children who are in the preschool age group and the school age group, roughly between 6 months and 8 years. All these kids are extremely prone for getting flu. And remember, flu is transmitted from the children to the adults. Okay, while COVID-19 we have seen is transmitted from adults to children. Okay, and that's why if we protect children, adults also will be protected. Imagine there is someone in the family who has diabetes, maybe your grandfather. Imagine your grandmother has asthma. These are called as conditions which compromise immunity. They bring our immunity down. They erode the immune system. Okay, they are the ones who are likely to get flu from that small little child. And if the child doesn't transmit, obviously they are protected. It's possible that the father is also diabetic, mother is pregnant. Even during pregnancy, mothers can catch influenza. So there are various people in the house. And if a child is protected between 6 months and 8 years, then obviously the others in the family also will be protected, and that's the priority. So one must take a flu shot as soon as the baby completes 6 months.
All right, Dr. Joe, can I just add to that point, and then I have a question for you too, Neha, about vaccination. But Dr. Joe, you're talking about flu, and we all think flu is the common flu is not that a big deal and not that serious. But is it? Does it cause complications for children? Are children more prone to complications because of this influenza? And is there any data about the number of children who actually get influenza or are affected by influenza, and what are the kind of complications that can actually uh, happen? Or is it something that's not really serious, even if a child
Yeah, yeah.
catches flu?
Yeah, I can understand. The notion that flu is not a serious disease is something which is wrong. Remember, it's a notion in the common people. The other day, there was a small little child who came with a doll in the hand, and she was sitting by the side of the parents. And this particular child was unwell, and I was just examining. And she was speaking to the doll and telling the doll, "Don't worry, it's viral, viral, don't worry." Okay, so even children feel that the viral means something very mild. It's not so.
Yeah,
Remember,
yeah.
influenza in particular complicates as pneumonia. Okay, the virus
Oh.
which is in the nose can very well go down to the lungs, and then it can
Mhm.
produce pneumonia. There are different types of pneumonias, and as I told you, it can spread to others. And I told you that children are the major spreaders. So influenza is not that simple. Okay, and whenever it was thought during COVID times, in case a flu combines with COVID 19, people did studies whether both, when they attack together, whether seriousness would be more. Okay. The seriousness, whether it would be more or no, it remained, a topic for discussion. But one thing is certain, that if a child or an adult is vaccinated against flu, when a treating physician comes across a child with cold, cough, or fever, or an adult with cold, cough, and fever, he is sure that at least for 70%, this chap doesn't have flu because he has been vaccinated. It could very well be COVID, but at least there is some assurance at the back of mind that this chap has been immunized against influenza. But do not take influenza lightly, because of
Oh,
40%
okay.
children in the preschool age and almost 30% in the school age, they have this influenza activity, and all of them are prone, particularly those who have that immunocompromised state, immunity which is at a lower level, eroded level. Okay, and in our country, you can see so many children are malnourished. Their nutrition is not at par. It don't think that children who are from poor family are malnourished. It's no. Children who do not get anything to eat are also malnourished, and children get something to eat but they eat wrong things. They are also malnourished. Okay, so
Okay.
malnutrition is quite rampant, and as I told you,
Yes.
other conditions in the family also. Right.
Yes. Okay. So Neha, we all discussing the importance of flu shots and vaccination. What are your views on vaccination, and do you follow a routine, for vaccination for your children? How do you feel about these flu shots?
I think it's very important, I mean, I'm also a mother two times over, and I feel like the being a mother for the first time teaches you to be extremely cautious, and being a mother for the second time teaches you how to be a little more brave, because you've been through those beats. So for me, I feel as a mom, and I'm sure, like, all moms across the board do this. I'm very regimented, and like everything from his feeds to how many ounces of milk he's taken to how many feeds he's had to how many. I know it may be too much sometimes, to also noting down, in the initial months, how many times your child has passed urine. So, you need to know if the child is dehydrated or not. These are simple measures that you can take at home. Now, the other simple measure that you can take at home without um, actually reaching out to your doctor is knowing when the vaccination is required, because at birth they give you a chart, and I feel that you must follow that. I also feel that when doctor was talking, my son is 6 months, and he's between 6 and 7 months. His flu shot is has been long overdue, almost for 2 weeks, the first flu shot that happens at 6 months. And this is something that I've come to realize now, because he's had a cold for 2 weeks now. It's so tough to see a 6 month baby just have a runny nose for almost 2 weeks. And then you're like, okay, I'm going to push the vaccination a little more, because we've also been told,
Yeah. Okay, we're losing
somewhere
losing
ahead.
your connection. We're losing your connection there, Neha.
Now
I'll come back to you. I'll come back to you. I
I
think
can
your
see
voice
you,
is breaking. Yeah, your voice is breaking. Continue if you can hear us. Your voice was breaking.
but can you see me now? Yeah,
Yeah.
I can.
Yes.
Yeah, I can hear you. I can hear you.
Yeah.
No,
All
so
right.
I'm just saying that we can what we can do as parents or responsible parents, which we all are, is to make sure that we take our flu shots and influenza shots and all our shots in time. Now, there's a huge myth that has been cleared out, and for me, that if your child has a mild cold, you can go ahead and take the vaccination. Literally, while I was speaking, I was multitasking, and I was like, I'm going for the shot immediately tomorrow morning. So I feel that what we can do is maintain, follow timeline, follow chart. Again, I say prevent ourselves as opposed to looking for the cure. So yes, for me, it has to be for both my children, extremely regimented. But now I also think that some pair, and I'm going to admit this here, that maybe so we take our flu shots once a year, and we're like, okay, le lenge, until actually somebody gets that flu or gets that cold, and you're like, acha, humko bhi shot le lena chahiye. But why get there? This is the one thing that I've kind of been telling myself and it needs to be done in time, and all of us collectively are going to do this. Um, but again, there's another doubt when it comes to taking flu shots and boosters, and the world is at a point where between COVID vaccination and boosters. So is there like a correlation or a time between the booster and the flu shot? Doctor, my question is to you.
Yeah.
Every time I'm asked a question, I have one more for you.
No, that's good. That's good. I am sure you will be the best vaccine advocate for the vaccination campaign. I will tell you one important thing is that now that you are motivated to get your son vaccinated, that's good because monsoon is the season when flu is rampant, and that's why if you give it in the month of April or May, it takes at least 15 days for the body to build the immunity. So if you protect them earlier, then they will be protected during the monsoon. Okay. And you had a question about this interval between COVID-19 booster vaccination and
Yes,
flu vaccination. Of course,
yes.
both these vaccines are scientifically not connected with each other. That's why both of them can very well be given together. However, there are some cases where we do get some reaction with either of them, a reaction in the sense of fever and body ache and all. So it is prudent advice to keep a gap of at least 2 weeks, maybe 4 weeks also, but roughly 2 weeks gap is better, so that you are just out of the pain or body ache with the first vaccine, and then you go ahead and take the second shot. So that's the answer
All
for
right.
your question as to what should be the interval. Yeah.
Okay, so you're saying that it should not be really co-administered, the flu
No,
vaccine and the COVID
yeah,
19.
the recommendation is for co-administration of both the vaccines. However, in practice, many times, for parents, to give rather or to take two shots at once, sometimes becomes little embarrassing or maybe troublesome.
Yes.
And as I
Hmm.
said, if they get fever, because some of these vaccines they do produce, particularly COVID-19 vaccine, when it is taken in the arm, it produces soreness of the arm, and then for a day or two you are unwell, and you
Hmm.
really would like to take rest. So you finish COVID
Yes.
19 vaccination because it's the priority these days. But do
Hmm.
not forget influenza vaccination. If you are
Hmm.
confident that you won't have any problem, then you can always take both of them at the same time on the same day also. Scientifically, there is nothing wrong. Medically, I'll say there won't be any major problem. However, I was just trying to tell the parents that in case if they take at an interval
You
of
can keep
15
a
days,
gap. Huh.
that's
Hmm.
also fine, because then
Hmm.
they can very well come out of the initial by minor side effects and then have the next one. Yeah.
Mm. And COVID 19 has not really gone away, right? I mean, it's still there. It's supposed to be again peaking in June, God forbid. But and in Delhi and elsewhere in North India, we are seeing a resurgence of COVID 19, another variant of COVID 19. In that case, Dr. Jog, uh, would you like to clarify how does one differentiate between influenza virus and the COVID 19 virus? I mean, the
Yeah,
symptoms are
I
more
will
or
tell you.
less same.
No, no. Actually, see, these days, whosoever comes to our clinic with fever, cough, and cold, more so last year, we used to take it as COVID-19 unless proved
Mm.
otherwise. Okay. But
Mm.
now that
Mm.
the pandemic and the number of cases is on decline, going down and down, and the heat wave is there, and the influenza season has started, we are also looking for this influenza. Okay. However, we are keeping COVID-19 at the back of mind in each and every case. Fortunately, the severity of the symptoms in both these is the same. Okay, so it's mild, moderate, and severe. Mild means the child has only runny nose or mild fever, okay, and a little bit of body ache or headache. Moderate means where the respiratory system starts getting involved and breathing becomes a bit fast, okay. And serious, of course, is where the breathing difficulty increases and so many, and the oxygen saturation further goes down. So for both these diseases, the level of seriousness is the same. So we are keeping a watch not on the initial symptoms, but we are telling the parents that, see, now this child has cold and cough, but over next 2 or 3 days, if it's simple flu or any other virus which is not a dangerous one, okay, the child will recover in 3 to 5 days. But if it is COVID-19, it is important for you to note that the respiratory rate is normal, that the fever comes down, that the child is playful when the fever is not there, so on and so forth, and other things like the mentation of the child and the urine output and all. So we tell them that these are called in our words as red flags. Okay, some indicators that the child is worsening or not doing well. Fortunately, for most of these cases right now, this is not the case, and most of the children have very, very mild problem. Even during COVID-19, as all of us know, children have been affected, but to a very mild extent. Okay, so what you should remember is that you forget about the virus, because our parents are not concerned whether it is a rhinovirus or a respiratory syncytial virus. Names do not matter, the seriousness matters, and there we are looking at it, which is preventable. So flu is preventable, which is preventable, COVID-19 is preventable. Now, right now, we are giving vaccines for 12 to 14 and 15 to 18. That's fine. And maybe in future, we may start giving vaccines for 5 to 12 years also, these children. So right now, remember that influenza means runny nose and headache, body ache, and other symptoms. But COVID-19, in addition, has rapid progression from the nose down to the lungs. Okay, so in case if a child is going to get sicker and sicker, he may have increase in the respiratory rate. And as you know, in adults we do get loss of sense of taste and smell, which is not known in case of influenza. Okay, there are some minor differences which may not matter for the people in general, but it's very difficult, and I always say that it's even Rajnikant cannot differentiate between these three. Okay, so
Yes.
it's very important to know that we have to be on lookout for the red flags more than the name of the
Yes,
virus.
absolutely. Just be careful and watch the symptoms. Neha, do you have a question for Dr. Joe?
Yes, I do actually. This was going to be my question. Like, how do you differentiate between the three? But more importantly, I'm going to actually now go back to where you started from, and you said that as a parent, what are the precautions that you take? And when you think about it, you're always like, you keep kids away from other children, and as a parent, if my child is unwell, I make it my duty to inform other moms that I'm going to make sure that she stays indoors or he's kept away from other kids so they don't get anything, or mask up and all of that. But I'm going to redirect this question to Dr. Jog, because there's such insightful gems coming from him. That Doctor, why don't you tell us that as parents, and now because schools have reopened, as teachers who are going to be watching this, and and I'm hoping they're not watching it right now because these are school hours, but later on at some point, what are the precautions that parents and teachers can take to keep kids who go to school, that's almost every child right now, safe from all of this?
Right, right. Hey, thank you, Neha, for that question. It's important that the parents and the teachers remember that they are the role models for the children. Okay, so when you send the child to the school, it is important that first parents must get themselves vaccinated. I told you, flu is a family vaccination. Okay, grandparents also must get themselves vaccinated. If the child has fever, cold, and cough, they should not send the child to the school, because right now we have no way to find out whether it is flu or something else like COVID-19. So it's better that you keep children at home in case if they have fever, cough, and cold. When they reach the bus or the auto or the matador or whatever it is, the transport system, through which they go to the school, even the bus drivers and the others in the bus, they have to be immunized, because they are the ones who are in contact with the child, okay, they also have to be vaccinated against COVID. There is no doubt about it. Once children reach the school, there has to be screening at the entrance of the school, okay, maybe with that head gun which is measuring the temperature of the child. So each and every child who has fever and who is screened at the entrance to the school should not be allowed into the school. In case if the child is fit, then at the beginning of every lecture, the teachers must tell them some precautionary measures, because right now we are on the decline as regards COVID-19. But children should sit at a distance of at least 3 feet from each other. And after the lunch break or after they go to the washroom, they must use the hand sanitizers. Even during the lunch time, children should try and sit little away from each other and should not hug each other. Small children have all those habits, but then it's very, very difficult to follow all this, though I'm telling to you.
I know,
That
and
is
it's
one.
also it's very difficult. It's also heartbreaking to hear, like, to keep them away from
I know.
their friends. But I know you're coming from a good place and you're giving us great advice.
And then the teachers and the staff members in the school also should remember that they also need to be immunized. They also should be vaccinated. Okay. So children with whom they come in contact, everyone has to be rather immunized. So immunization of these chaps is extremely important so that children do not catch the infection. And immunization of adults, because as it's going on in the community against COVID-19, that is also important, because as I told you,
Yes.
adults are the major source of infection for children as regards COVID-19, and children should be protected against flu so that children will not transmit it to the adults. So it's something which is a joint responsibility, and whenever children come to the school, it will be prudent and wise to check the immunization record. As you said, parents value this immunization record to a great extent. I say that it's a passport for health. Okay, just as when we take out our passport, we tick one after other. Aadhaar card, yes, PAN card, this, that. Similarly, BCG, DPT, everything given. And child has taken flu vaccine. So yes, he can safely enter into the school. Something like that. Thank you.
Okay, but these flu shots also change every year. In fact, one of our the audience and people who are connected to us right now have a question around this. Ankit Nigojkar has a question that my kid got his flu shot last summer. Do we need to have it again this summer? Usually, what's the frequency for getting the shot? Because as you said, the flu virus changes. We all know that the strain changes every year, and so does the flu shot. So obviously, then it's imperative that we take it every year with every changing season.
It's very important that you take the shot every year. The first year, I told you 6 months and 7 months, when the baby is in the first year of life, this is something where the immunity starts building. Okay. Now there is a base or a foundation which has formed in the first year of life. And then in the second year, third year, fourth year, fifth year, every year, you have to take this shot, because the immunity which is given by the initial shots slowly over a period of about a year wanes off, it reduces. Okay. And we need to keep it tight. This is like our friendship. Okay. In case if there are two friends in the school, if unfortunately the other one gets transferred to some other place, it's the only way to keep in touch with each other is to talk to each other and meet each other every year. Similarly, just take it that the friendship is being tightened by these shots which are taken every year. Okay. So for flu, after the first year of life, remember, parents must take annual flu shot in India, particularly in the months of April and May, so that the immunity remains, very, very good during the monsoon season, and children do not catch the influenza infection. Thank you.
Mhm. There's a follow-up question on this. I mean, are these flu shots available on the counter, or do we need doctor's prescription for it?
Yeah, it's always better to take it from the doctors, because there is something called as a cold chain. Okay, all these vaccines are kept at a definite temperature, and when you get these vaccines from the medical shops, the temperature variations could probably affect the potency of the vaccine, and this vaccine may not be of help for the child. And doctors, when they preserve the vaccines, they keep the vaccines at the proper place in the refrigerator, and they are used to give these vaccines at the proper time, at the proper place in the body, and they will take all the precautions. So it is better that you go to the pediatrician or the doctor to whom you are usually taking your child to, and just tell them to give the vaccine. Please do not venture to get the vaccine from the market and request the doctor to give it and all, because this cold chain is something very important, and then the doctor is there to take the entire responsibility of the fever or any untoward event which occurs
Sure.
following immunization.
Yes. Yes. Yes, Dr. Chok, you've very, very well explained why do we need to take these flu shots, how important it is, what does it do, how does it help us. So, Neha, are you convinced now for the flu vaccination for your family?
Is that even a question? Of course, I am. Like I told you, I'm a multitasking mom, like most moms are. I wish I could share my chat from my other phone. I've been like on the chat. I'm like, when can I come? I'm landing back. I'm in Delhi right now. I'm like, I'm landing back 29 morning. Can I see you 29 morning? And I'm like trying to like, and pediatrician and doctors both are saying, pediatrician is like, no, 5 deliveries on 29th. I'm like, I'll come between the deliveries. So I'm like so desperate to take the flu shot because I just feel like, you know, um, there's no joy in being, I wouldn't say extremely sick or unwell, but in our house we use this term a lot, in being under the weather, or there's no joy in waiting to be in that situation, or saying that I look into it after it happens. So it's just because the monsoons are going to be here, you might as well make sure that the raincoat is there, before. So protect yourself from it, and it's not going to hurt. And also, along with monsoons and the summer comes summer vacations. Why do you want to ruin that time of the year for your children and for yourself? So make the most of it. Look after your children, and more importantly, look after yourself, because you love your children so much. You want to be healthy for yourself and for them.
Yeah,
Sure,
you're
absolutely.
right. You're right.
Yes.
And moreover, particularly even for those who are little grown up, like, there are adolescents who are going to appear for the 10th or the 12th standard. For them, to remain sick during the exam time or maybe before the exam is something which is not desirable, because, it impacts their educational performance also. So just as you said, why at all we should remain unwell when we have something, which is preventable. Okay. So
Hmm.
it's better that you prevent the preventable. And in medical terms, we always say prevention is always better than cure. So this is very, very, very true for influenza. Thank you.
Yes, absolutely. There's just one more question. I think you answered this question, but one of the audience here has asked a question. Is Nitin, what are the top three tip parents need to take to be ready for school or summer break? We've already spoken about how you need to take precautions and vaccinate your kids against influenza. But Dr. Job, maybe a closing message from you, or if you want to add something to that.
Yeah. During the months of summer, it's not only the respiratory viruses, but it's also important to take care through your hands. Wash them properly. Have boiled water. Have food from reliable sources. As far
Hmm.
as possible, see that you eat fresh and homemade food, because because of COVID, a lot of food has been there in the refrigerator. It will now slowly start coming into the market, and it's possible that you get infected with that. So have food from reliable sources, and
Hmm.
you have to take all the vaccines which your doctor recommends. Definitely the flu shot, but even during the months of summer, there are waterborne illnesses like typhoid and hepatitis A. So see that these diseases are also prevented. Be together, enjoy the summer. Children have been in the house for almost 2 years, and now they had an opportunity to go to the school. But now again during the vacation for a month, now parents know the importance of children being at home, going to the school. So, I think the responsible parents will take the proper hints and spend more time with children during the summer, because physical and mental health all go together. But physical and mental health will be normal only if children are healthy. So, physical health is at the top. So, let them not suffer with fever, cold, and cough and other illnesses. And this is possible only by preventive measures. And I always say that the word flu itself ends with you. Okay. So, it's you that you are going to be responsible for your own health and children's health. Thank you.
That's so
I,
interesting.
well, I'd,
That's
I'd
so
like to, I'd like to,
interesting.
I'd like to say, let's sum it up by giving the full form of flu, for love of you.
Oh,
That's brilliant. For love of you. Remember
Yeah.
that. Thank you, Neha. Thank you, Dr. Jog, for sharing those insights, sharing your thoughts with us. So thank you for joining, and to all of you who've joined us today as we approach the flu season. Make sure that you give your children and the elderly the flu shot in time. As Dr. Jog mentioned, this is the time that you can go in for the flu shots, because the monsoon is the season when influenza cases start increasing. So if you take your flu shots now, then the vaccine, the required period for the vaccine to be effective is met with, as we've heard from Dr. Jog. So, meet your pediatricians as soon as possible, consult your pediatrician and take the flu vaccines, or call VaxLine. Once again, I would like to thank Sanofi for partnering with us for today's discussion. So stay well and stay healthy. Thank you.
Thank you, Nagma. Thank you, Dr. Jog, and all of you know exactly what to do. Pick up the phone and you know who to call.
Okay. Bye.
Bye. Thank you.
Thank